Hello, my name is Brandy Lynd, and I'm doing this presentation on homelessness. So we'll start out about the economic and social causes. Poverty is like the number one for homelessness. A lack of affordable housing goes along with poverty, unreliable body and mental health, addictions and substance abuse, also community and family disintegration. So this little picture I found, a little cartoon, and I thought it was kind of cute, and it kind of explained some more reasons why, some causes for homelessness. So domestic violence is another one that you see for homelessness, and that is because it could be a female or a male trying to escape domestic violence and has nowhere to go, so they become homeless. Also, I noticed the assistance cut, so they have got their assistance, and that could be their SNAP, which is, which I'll talk on the next couple of slides, but SNAP is their food assistance that has been cut, or their Social Security has been cut, anything like that. The LGBTQ family rejection, so that somebody has came out to their families and the family has rejected them and they have nowhere to go, so they become homeless. PTSD and mental health. I see this all the time working at the VA. We have veterans that suffer with PTSD and mental illness, and even though they have family that will help them, they're too prideful with this and do not want to take help from their family. They'd rather just be homeless. So the annual homeless assessment report, which is also HUD, there was 326,000 individuals in the United States experiencing homelessness. On a single night in 2021, there was 131,377 individuals were experienced sheltered family homelessness. Sheltered youth homelessness accounted for 15,753 people under the age of 25. Sheltered homelessness affects an average of 41,000 family homes. So not everybody that is homelessness, and when we think of homelessness, meaning they live out on the street. Sheltered means that they are either living in a shelter or they may be living on somebody's couch, been just couch hopping basically in between friends or families' homes. Not everybody that is homeless is actually living on the street. They're, just basically just trying to find a place to lay their head. So children born into homelessness. Children born to homeless parents are more likely to be homeless adults. This is how homelessness has an impact on future generations. Poor physical health due to lack of sufficient prenatal care. Unable to attend schools. So children that are born into homelessness, they'll probably be unable to attend schools, or they're switched from school to school to school because they're homeless and their parents are just trying to find a place to lay their head down. Higher likelihood of acquiring major mental health problems, and poor health due to not sufficient enough of health care. So I think that the mental health problems and the health care go hand in hand. They don't go get the help that they need for the mental health problems, and they don't get the help that they need for the health care. So a couple of programs that are offered is the Supplementary Nutrition Assistant Program, also known as SNAP. Um, that is a financially, and it helps families pay for food. And this is based on family income and how many people are in your family, and then they're based how much you get of the assistance. This helps pay for food. The Temporary Assistance for Needy Families, also known as TANF, is a financial support, improves the family's capacity to pay their rent. So this is like a cash assistance to help pay for rent, or to help, I guess, pay for like a gas bill or electric bill. It's like a cash assistance. So why use public assistance? So keeping individuals in their home reduces the stress of homelessness. Prevent more people from entering the emergency systems later, which kind of means like having to go to the shelters, or getting evicted from their homes and going to the shelters. Prevent housing, health, and social services to be used more effectively and efficiently. Okay, so some interventions. Some of the interventions is the Housing First program, which is it helps families find affordable housing and help with the deposit. That there's grant money that helps with the deposit, and this is a logical thing to do with keeping families in their homes. So instead of getting evicted, Housing First will help keep you in that house. Um, the grant money, providing individuals with support services and community resources to keep their housing and not to become homeless again. So just like Housing First mentioned, with the grant money, so that grant money would be used to help individuals with services and community resources. Healthcare. I think this is another one. Helping people sign up for healthcare assistance with help for healthcare would allow these households to treat and manage those conditions that limit them from getting a job or having a stable job. So if people would get the healthcare that they needed, they would be able to work, instead of calling off all the time and losing a job because they're sick. They could go to the doctor and actually get the health care to keep their job. So another one that I found very interesting is a career pathways by providing accessible job training and employment for those living with a home. This would enable a person to get some type of trade underneath their belt to want to get a job and keep it. So people willing to get a trade or some type of career under their belt would help them get the job that they want and the job that they enjoy. This would actually help them get a better job that has good insurance, maybe even 401k, actually give them a job that they enjoy going to work. There's some references. A few things. Homelessness is, like I have mentioned, is not all about watching people on the street. Homelessness affects not only one person, but it affects our society. And as our society, we need to change that and help with helping the homeless. So with that being said, thank you all, and I hope you all have the rest of a good semester. We only got a couple more weeks left.